We shall now step into the beautiful world of Khan's Digital World. The host here is the world's leading digital expert, Dr. Badrul Khan. Dr. Khan is a well-known scientist. Today, Dr. Khan looks into eHealth exchange. His guest of honor is Mr. Mark Hamra, who is a medical information exchange expert.
Welcome to Khan's Digital World. I'm Badrul Khan. Today, our episode is entitled eHealth Exchange. We are living in the digital world. Everything that we do around us because of technology, the data on us, our profiles, are recorded, stored somewhere else. In the medical field, same thing's happening. Today, I'm so honored to have Dr. Mark Hamra, a passionate physician, a passionate in technology, and I'm going to talk about that, how passionate he is in technology to use in the field of healthcare. Welcome, Dr. Hamra.
Dr. Khan, thank you for having me.
I'm very pleased to have you on our show. Now, as you know that we are in the digital world, that our medical data are always stored and created. And let me try to understand, what is eHealth Exchange?
eHealth Exchange is a concept of sharing healthcare information on patients between organizations, between providers, that has been around for over 10 years. At least I've been working on it for over 10 years. And it involves allowing you to electronically exchange a patient's information instead of having to carry a paper chart or fax information back and forth between offices. So you shorten the time that it takes to move a patient's critical information from one physician to another.
Well, so it seems that physicians now have any patient's data in your by stroke of a key in a computer or a smartphone, that you can get everything about your patients.
I wish we were there. We've come a long way in the last 10 years, but and to give you a little history, when I started working in this field, information was shared solely by fax machine or making phone calls or mail. The physicians, the providers knew they were already using computers, starting to use electronic medical records, and thought, why can't this information be exchanged? Why do I have to mail it? Why do I have to print it and send it? Why can't we just share this information? And there were a lot of roadblocks along the way. But over the past 10 years, I'm happy to say that today we are sharing quite a bit of information between many organizations, both state and federal and commercial.
So it is beneficial for both patients and also professionals who provide healthcare support to their patients.
It is. That's never been the problem. Providers always want to share information about their patients with one another to give better diagnoses, better treatment plans.
So would you think that any organizations would like to share this information with another organization?
That varies. In the beginning, organizations were afraid that sharing large amounts of their information of their patients, giving access to another organization to their databases, would allow them to have business practices that might not help. It might benefit one over the other. So they were hesitant. And commercial organizations, frankly, wouldn't share information.
How about I'm a general public, and my health information, you have them because you are my medical physician or my primary care physician. Now, can I trust you with that data about me?
You've always been able to trust your doctor with the information. That's the doctor-patient privilege.
Very good.
But large organizations don't think that way. commercial. I shouldn't say organizations. Let's talk about commercial organizations. They look to protect their client base from a business perspective. Physicians, IT professionals, physicians that are IT professionals like myself, we don't think that way. We want to move that information. So what happened was large federal organizations who don't have those constraints, they showed the way. A governmental organization, semi-governmental, called the Office of the National Coordinator, ONC, created eHealth Exchange and other projects, one called Sequoia, which are protocols that show a framework or a process for sharing information. And then ONC took that information and started to work with commercial partners in large working groups over several years to develop a framework for the commercial healthcare organizations to become comfortable that they could share patients' information without putting at risk their business.
Oh, that's wonderful. So for patients like me, how that benefits me, you're having access to my information, and my information is on the cloud, and I have no idea what one can do with it. So is it really beneficial for patients?
That's a good question. The way it benefits patients is reducing the time to access information. So as a quick example, if that's okay?
Yes, sure, please.
I'm your primary care doctor. That's what I do, is primary care medicine. And I send you to see the cardiologist. And the cardiologist sees you and he has a plan for you. Now, he can print that information and hand it to you, because you're going to come back and see me to execute the plan. He can fax that information or mail it. And up until 3 or 4 years ago, it got mailed. Your cardiologist would mail that information, your neurologist would mail it to your primary care physician. Now, and that takes how long? That takes time. Now, and it could get lost in the mail, the fax might not be turned on, there's all kinds of points of failure. With health exchanges, electronic health exchanges, the information is very securely published to a health exchange that there are data use agreements between the organizations. That allows me as a primary care provider to actually see what the cardiologist did in his system. So he's using an electronic medical record different than mine. He sees you and puts in the plan, but that information is now, because of standardization, is visible in my EMR, my electronic medical record.
I see.
And you couldn't get lost. I know it's you. You and I can look at it the same day if we want to. As soon as he puts it in, it's instantly there. So something that could have taken days or weeks is merely seconds now.
Well, I heard Dr. Mehra, he's one of the very prominent practitioners.
I saw him on your program.
Yes, and I asked him these questions about having access to just in time, so much data about your patient. Are you overwhelmed? Are you losing some kind of physical, interpersonal relationship that we used to have with doctors, patient-doctor relationship? And you have all the information about me, and you just become a computer wizard, and you go in there and, oh, your diabetes, this and all this, and then, okay, you got to do this. You're probably not looking at my eye. You're just relying on the data. So are we losing any personal relationship that we used to have between a physician and a patient?
It depends on your physician, I guess. I wouldn't blame the computer. Having an overwhelming amount of information is a risk, and it's a problem that we are addressing. It has been a problem. That's exactly right. So what we have to do is be smarter as technologists in the ability to filter the information to present what is appropriate medical information to the appropriate provider. Your orthopedic surgeon doesn't need to see your heart tracing. He needs to see your x-ray. And so what we've gotten better at over the years is presenting the appropriate information to the appropriate person at the right time.
A very targeted, needs-based information.
Yes, that you can very quickly back away from and get the whole picture again. Like, you can go back into the data overload and then dive back down in and pick what you want and then come back out. I mean, it's no different than the internet. You find what you want on the internet, but it's all there in the beginning, right?
All the doctors that when I was growing up, going to undergrad, I was a chemistry major, my friends went to pre-med, and they're always like starting hard and hard. I never thought they're going to be becoming a doctor with computers, So it looks like the doctors sometimes looks like IT professionals these days because they deal so much with these technologies to serve their patients.
It would be, it sounds good to just have a stethoscope and a neurological hammer, but to have an EKG, a CT scanner is just more technology, but it's invaluable. A heart tracing, an MRI, these are all just other forms of technology, and an electronic medical record is no different. A CT scanner replaced. I can listen to you with my stethoscope, but then I could see into your chest with the CT scan. I could carry around a giant chart, or I could turn technology into a benefit where I could see into your data more clearly than I could before, even though there's so much of it. And we do have more and more data. So people, I think, would become overwhelmed without technology. The doctors would become overwhelmed by the information.
So if this overwhelming information availability may cause some problems for medical field. The reason I'm saying that's like a medical students, like today's high school students, they are multitasker. And they are basically, technology savvy. Now, if this school children going to colleges and the medical college, for them it's okay because they are used to. But you have to remember the patients that we have, we are not that technology savvy, and we are always like to see someone come and touch me and talk to me.
And they still should. This doesn't replace that. If that's happening, then that's a bad path to take, in my opinion. I use the electronic medical record as a chart, just like a paper chart.
I see.
It hasn't reduced the amount of time I look at my patient or touch my patient or listen to my patient. If you're listening to your electronic medical record and not to your patient, you're making a mistake.
Very good.
As a physician.
Very good to hear that. Now, I know the U.S. government has a tremendous interest in making large organizations interoperability, talking to each other, so medical and healthcare professionals can have access to patients' data just in time. Are you aware of such innovation going on, and how is it going? Are these innovations in the advanced state?
I have worked with the largest government healthcare organizations. That's my primary focus of late because they are the forefront. They are leading the way. They're not perfect. We have a ways to go. But as far as having the infrastructure in place to do the sharing, they're leading the way. The large governmental organizations that I work with, they are now moving from that phase of just figuring out how large organizations talk to one another from an IT perspective, what the wires look like in the channels, to starting to consolidate what the information should look like, how for patient safety reasons information should appear the same on both ends of the line. And those standards, the ONC again is leading the way, and those standards are being set and they're being exercised and tested, and then we'll move into the phase where, and we've already done, well, commercial will move into the phase, the government's already done this, where implementation modeling is being set. So the ONC again is leading the way for referential implementation modeling, and so they tell you how to implement the standards so that when you say weight is in pounds on one side and weight is in kilograms on the other, there's no confusion between the two. You don't have kilograms showing up as pounds. That's a simple example. That's not a very good one. But
very good. In fact, I'm very fascinated by your interest in technology. I know you're a physician and you have a passion for technology. I think our newer and newer young doctors are coming. They're going to be technology savvy, and the digital world that we envision, that in this digital world we needed doctors like him, young doctors who understand the technology, their attributes, and how they can help us, how can help us to benefit our health, improve our health. So it's been a pleasure to have you, Dr. Hamra, and hope to have you again sometime.
My honor, Dr. Khan. Thank you.
Folks, we'll see you next time with the newer digital technology issues. Thank you.